It's time again for Health Monitor, the #1 program that shows you how to live a life in its healthiest way. To improve the quality of health and life and inspire you and give you the hope that you can live a healthy life every day. It's Health Monitor, yeah. Your guide to good health. It's Health Monitor, the #1 health show, yeah.
Welcome to another episode of your favorite health program, Health Monitor, your guide to good health. I am Adenike Famujuro Fakayode, and today's program, as usual, we have the health tips segment, assisted conception, and body care. Let's go on a short break. We'll be right back.
It's Health Monitor, the #1 health show.
Cucumber. Cucumber contains an anti-inflammatory flavonoid called fistin that appears to play an important role in brain health and protecting your nerve cell from age-related decline. Cucumber helps to lower your risk of breast, uterine, ovarian, and prostate cancer. Cucumber helps food to move through your digestive tract quickly for healthy elimination. Did you know placing a cucumber slice on the roof of your mouth may help to get rid of mouth odor causing bacteria?
It's Health Monitor, the #1 health show.
Since there are two tubes, if a woman has one of the tubes blocked, then there is a theoretical 50% chance in getting pregnant. We've had a 62-year-old woman got pregnant with twins and delivered.
Many women go from one hospital to the other, trying to cure what is not actually a disease.
My name is Dr. Olushola Akini. I'm a gynecologist and a fertility expert. I want to talk briefly on low sperm count, the issue of low sperm count. I have had calls from most of our men asking me for directions on how to manage this issue oftentimes. And I believe that it is apt for us to give some insights into this issue. Low sperm count means that the sperm cells in your ejaculate, the number is few. There are degrees of low sperm count. That is, for every mil of the ejaculate, we expect about 20 million sperm cells. When I say this, I would like to add that sperm cells are not what we can see with our naked eyes. So do not ejaculate and start looking for sperm cells in your ejaculate. These are things we see under the microscope. They are like tadpoles. We should see about 20 million of these tadpole-like cells inside 1 mil of the ejaculate. When we see lower than this, then we say that there is reduced sperm count. That is what doctors call oligospermia. There are two categories. You can have sperm cells just less than 20 million, say 10, 15 million. It is still lower than cited 20 million. But when the count is less than 5 million in a mil of the ejaculate, then we say that the man has severe oligospermia. That is, the relative potential to achieve pregnancy becomes worse. Let me just add now that currently the WHO has revised this figure downwards, and it is currently being debated because we have found out that perhaps this issue of low sperm count should be also cited with respect to the community and environment. Initially, like I said, the normal used to be 20 million per mil. But now, 20 million per mil because those who did the study actually did not take into account the total picture involved in infertility in men. Now, we know that below 20 million, in those days, the fertility potential of a man is reduced. But so much now, the thought is being reconsidered. And now we know that even though the concentration of the absolute count of the sperm cells, the absolute count is good, but it is the total now that we work with currently, the total sperm count, that is more important than the concentration. But I want to say that oligospermia, which means reduced sperm count, either way, whichever way you want to consider it, has reduced potential in terms of reproduction. When the man has oligospermia, there is reduced potential. It does not mean that God cannot do it, but we're talking medically and going with figures and facts. The lower figure now that reproductive experts are working with has taken into cognizance the community and the population of infertile as well as fertile men, unlike the old figure of 20 million. Now, having said that, there are so many causes of reasons why a man can have reduced sperm cells. Some of them are genetic, that is, when a problem is genetic, that is the way God created you. You have the genes that cause a disease that results in either you having no sperm cells or having low sperm count. Some are acquired, that is to say that this problem can develop after birth, maybe at one point or the other in life. Many of these causes are also environmental. All right? Time does not permit me to go into all these reasons now, but I want to say that in IVF, there is a universal solution to the problem of low sperm count. It is called intracytoplasmic sperm injection. All right? And this is called ICSI. Now, naturally, for sperm cells to be able to fertilize an egg, you need several hundred thousands of able, viable sperm cells to surround just one egg for the purpose of fertilization. And once the egg and the sperm cell, the chosen sperm cell, combines together, the rest sperm cells around the egg are arrested. And eventually they die off. So what I'm saying is that despite the fact that we ejaculate in millions, we only need several hundred thousands to surround the egg. And out of these several hundred thousands, we need just one single egg. In fact, if two sperm cells fertilize one egg, we call it polyspermy in medical parlance, and that's a disease in itself, that egg is not compatible with life. Okay? So what I'm trying to say is that we need one, but we produce several millions. Okay? Now, that is the reason why if you don't have the millions, then your potential to fertilize an egg is much reduced. With science, since we know we need one sperm to fertilize one egg, all right, science has made it possible to have a machine that will pick the best sperm that you have and inject it directly into the egg for the purpose of fertilization. That is what is called intracytoplasmic sperm injection. And then fertilization will take place. So it then means that if I get 15 eggs from your woman, I only need 15 sperm cells instead of needing several millions that you would have needed in a natural conception. And if you have low sperm count, which means that you cannot afford several millions because you don't have it. All right? So with ICSI that we do here at True Care Fertility Center, we have a machine called a micromanipulator that does this, and then we manipulate it to pick the best sperm, and we inject it into the egg, and then fertilization takes place. So this is the universal solution all over the world for low sperm count. So I want to encourage men out there who have low sperm count. Do not despair. I think if you visit a clinic like ours, after thorough investigation, will make a correct diagnosis, and then would fashion out an appropriate pregnancy program for you and your wife. If it is low sperm count, you probably will need ICSI. Since there are two tubes, if a woman has one of the tubes blocked, then there's a theoretical 50% chance in getting pregnant. We've had a 62-year-old woman got pregnant with twins and delivered.
Many women go from one hospital to the other, trying to cure what is not actually a disease.
It's Health Monitor, the #1 health show.
How to maintain a healthy lung. Most people breathe about 20,000 times per day. Do not take the health of your lungs for granted. So follow these steps. Avoid irritants, pollution, bacteria, viruses, chemicals, and gas fumes. All can aggravate your lungs.
It's Health Monitor, the #1 health show.
So when we leave that and we go to other areas like acupuncture, which I've talked about, that is an area where I am highly inclined. Acupuncture is a form of Chinese traditional medicine invented by the Chinese before the birth of Christ. It entails using some forms of very tiny needles such as this. These needles are very, very tiny. Tiny needles like this, are inserted in some selected points in the body. This is a model, those are the points. When you insert these needles into this point, there are three things that can happen. One, it will be able to cure some ailment that cannot be easily treated with Western medicine. These are verified, no argument. Yes. Secondly, it is one of the best ways to treat pains. Even the medical doctors have agreed that the best form of pain therapy is acupuncture, Third, you can procure anesthesia for surgery. The meaning of that is that if you want to cut or you want to operate on somebody, all you need to do is put the pin in the appropriate places. You can go on to do your surgery. The patient will not only be conscious, but he will be able to do some things. For example, the patient can tell you, "I'm thirsty," and you give him water. The Chinese did this in the year 1971 when the then president of America, Harold Nixon, visited Beijing. He saw the Chinese acupuncturist performing an open heart surgery. And the patient was not only conscious, he was asking for orange juice to drink. And this thing marveled the whole medical world that, wow, these Chinese, they are something else. Today, acupuncture is very popular all over the world. And the federal government of Nigeria, they are trying to incorporate it into our healthcare delivery system. What we are saying in essence is that all aspects of medicine are useful. And this is an area where, especially people in Africa, we need to change our mindset about medicine. It is not only white medicine that is invaluable, that doesn't have a social side effect. We should incorporate all our medicine. That is even the white, that's what they do. If you go to developed countries now, the message is integrative medicine. People combine medicine together. They combine acupuncture with Western medicine, with naturopathy, with osteopathy. All those people traveling outside, they are not going there to be given some tablets. They are going there to take all this form of therapy. So, and I'm very happy that the federal government of Nigeria, they are taking the initiative by creating a department called TCAM. TCAM means Traditional Complementary and Alternative Medicine. In Abuja, we have a department. I happen to be a member of that interim committee. Actually, the aim of government is to make sure that this department is created in all the 36 states. That was a decision taken in the last National Council of Health meeting held at Asaba at 2019. So, and I'm sure some states are warming up now to create that department called TCAM. The reason is very simple. We have discovered that Western medicine cannot solve all our problems. Take, for example, ordinary malaria. Today, when people take the usual malaria treatment, which you all know, lumefantrine and artemether, at the end of the day, people will still end up taking agbo. So why are we drinking this agbo codedly? Why can't we even formalize it so that you know that when you are sick, part of your remedy should be to take all this agbo. But when we say agbo, we are not saying you should turn your mouth to dustbin and start drinking anything. Those ones that have been certified by Lagos State Traditional Medicine Board, We have some people today that have been certified. So if you are one of those people peddling all this agbo and you are yet to be certified by Lagos State Traditional Medicine Board, you better watch your back. So the Lagos State Traditional Medicine Board was created in 1980 by our former governor, the first executive governor of Lagos State, that is Alhaji Lateef Jakonde. And that board happens to be the most formidable in the country today. So kudos to Lagos State government. Other states are also following suit. So there is need to regulate our own medicine. If you want other people to take us serious, we must regulate our own medicine properly. And Lagos State Traditional Medicine Board has been in the forefront of doing this. And I'm sure the current Lagos State government, they are trying to see how they can even take this to another level, to the next level. So for our health to be taken to the next level, all aspects of medicine should be recognized. Western medicine should be recognized. Alternative medicine should be recognized. And as a matter of fact, the WHO has divided it into 3 parts. The WHO is the highest body regulating healthcare practice worldwide. See what happened 3 years ago. It was reported that 3 major infections are ravaging the whole world, and antibiotics cannot really take care of those infections. What are they? E. coli, Salmonella, and Staphylococcus. Americans, they have spent billions of naira on these 3 infections. The Americans now call them the 3 mega bucks. They've spent billions of naira, but they cannot really get rid of this. So China got up. China said, I've been able to curtail these diseases using our own herbal medicine. India got up. India said, I've been able to curtail this using our own Ayurveda medicine. So WHO now instructed all the member countries, go back to your folklore medicine. Folklore medicine means those medicine you have been practicing before the advent of Western medicine. Maybe that was what informed the decision of so many countries now to now start regulating and recognizing complementary and traditional medicine. We cannot do without it. This is where we were grown, we went around all these things. So we have to develop that aspect. So what I'm saying in effect is the WHO has been able to now classify the 3. We have 3 aspects of medicine. We have the Western medicine. These are where you see the medical doctors using synthetic drugs, surgery, all sorts of very advanced diagnostic techniques and all this. Kudos to Western medicine, because without them, we would have all been uncivilized. But then there are some shortfalls there. They cannot cure everything. So apart from that, they also have traditional medicine. Each locality has its own forms of traditional medicine. Like in Nigeria now, we have the Ijaws. The Ijaws are noted for massage, And the people in the north, they are noted for using horn, especially when they are dealing with pains and some certain skin contortion. Horn therapy is also recognized in acupuncture. But in acupuncture, they call their own cupping. So the Hausas, what they are doing is correct. They have been doing it for years to treat so many ailments, So, and apart from traditional medicine, we have complementary and alternative medicine. It started with alternative medicine, but they have to change that nomenclature because the medical doctors are threatening that, why are you calling it alternative? Are you trying to say it's better than us? So they could change that. Let me use that word, to complementary medicine, so that what you have done, which you've not been able to do well, will now complement it, just as Eve complemented Adam in the Garden of Eden, So that was how that was done. So, and that is the only way our medicine can move to the next level, because it has been established now that Western medicine cannot solve all our health issues, except if you want to be hypocritical about it. And I don't want the medical doctors to start feeling insecure as a result of this development, because the healthcare situation in the country lies on all of us, not just some group of people, And I'm looking forward to a time in this country when a non-medical doctor will be made Minister for Health, unlike what it is now. What we are not saying medical doctors should not be, but they should also allow other people to be. Life is about live and let live. It is when we are collectively doing things that we can move to the next level. Look at other countries of the world that are developed today, like China, like India. They encourage all aspects of medicine. So what is wrong with us in Nigeria? And we have the best brains in this country. So there is nothing stopping us from encouraging this aspect of medicine. And that is why I want to commend this very program that we are doing. One of the programs projecting and propagating the tenets of complementary and alternative medicine. Kudos to this station. And I hope we can continue like that. Because we need this type of knowledge at this time of the end, when we have scourge of fake medicine, fake medicine all over the place, and so on and so forth. People are abusing drugs here and there. So there are a lot of things that complementary medicine can do. Do you know that complementary medicine can also treat addiction? This time around, when people are just abusing medicine here and there, we're having all sorts of juvenile lunatics all over the place, no sanity and all these things. Complementary medicine can bring about a situation in which all these issues can be sanitized. We don't necessarily be going abroad because somebody is coughing. It always bothers me when I'm traveling and I saw people clutching X-ray and some health document in their hands. Where are you going? We are going to India. We are going to US. I asked one of them one day, those people in India, are they not dying? So, but the issue is we also have our people in this country who are better off. But because these subsequent authorities, they have not been taking this issue seriously, that is why our healthcare delivery system is still suffering today. So we should take the bull by the horn. We should encourage complementary alternative medicine. We should encourage Western medicine. We should also encourage traditional medicine. The traditional healers, they have a lot of role to play in our healthcare delivery system too, And the government should also develop that aspect. What we are saying is that when you are doing your budget for health, leave some chunk for complementary medicine, leave some chunk for traditional medicine. Unlike what it is today, whereby all these two I mentioned, both complementary alternative medicine and traditional medicine, they are only living on crumbs. No budget is allocated to them. With that, our healthcare delivery system will not grow. It's not going to grow. So until that time, government is able to put its beam its light on this, and I want people in National Assembly to take note of this too.
It's Health Monitor, the #1 health show.
Cucumber. Cucumber contains an anti-inflammatory flavonoid called fistin that appears to play an important role in brain health and protecting your nerve cell from age-related decline. Cucumber helps to lower your risk of breast, uterine, ovarian, and prostate cancer. Cucumber helps food to move through your digestive tract quickly for healthy elimination. Did you know placing a cucumber slice on the roof of your mouth may help to get rid of mouth odor causing bacteria?
It's Health Monitor, the #1 health show.
This is where we draw the curtain on today's episode of your favorite health program, Health Monitor, your guide to good health. And I hope you have learnt more on today's episode. Till I come your way next time, I am Adenike Famujuro Fakayode. Be healthy and stay healthy.